Thank you so much for your introduction. It's a real pleasure to be with you all here today. I'd love today to talk about three things. First of all, lessons learned while building AI interfaces for patients. We've been doing this already for roughly 4 years. Second of all, how voice AI could make a real change in people's lives and help them in daily treatment. And third of all, about some of the recent lessons learned and our huge company changes and how we went from being a tech product we're a services company, and why I really think that in order to make a change in healthcare, you in most cases have to be a services company. So it all started from in the time when I was still a medical student. The very beginning of this story is when I went to my first summer clerkship at the Department of Cardiology. And at that time, it was like late 2015, I've noticed how many patients are having troubles with keeping to what their doctor told them to do when they're being discharged from the hospital and they go home. And I realized that there's not really any kind of efficient and a good solution to keep them in the loop and follow up remotely. So I understood that there's a need for a totally new type of interface. And so, as you sure know, that's the case in most countries around the globe. Unplanned readmissions are a huge problem for both sides. For the patient, as nobody likes to get back to the hospital, and also for healthcare systems producing huge costs. The first way of tackling this problem was a very basic one. It was a typical startup stage developed in a garage. So we created first line of cubes. We call them CardioCubes as they were mostly in the beginning for cardio patients. And so they were making notifications about taking pills, doing measurements, and all sorts of basic things through our own customly created hardware and software. And we realized that this project makes a lot of sense when one of our patients said, I felt that Dr. Oskar is with me at home and he would be sad if I don't take my pills on a daily basis. We've noticed that a patient can really form a bond, a relationship with just a white box with notifications. So we said how to make it work both sides and how to allow for a two-side communication. That was the moment when we realized that the smart speaker market is growing really, really fastly. And right now, currently, it's over 1 billion devices that provide a voice assistant access today. So we said, let's focus purely on the software part and use like consumer devices. And so the idea from the very beginning was let's deploy. We started with Amazon Echoes. So Amazon Echoes with Alexa to patients' homes with our software working on top of them. So they'll be able to have daily conversations and daily check ins with the robot, with our AI. And then all this data will be gathered and sent back to the hospital and will be part of the so called patient note inside of the electronic medical record. So doctor can access this data, see how this patient is doing, and also react faster if there's any kind of worsening trend. As all doctors love, we then created several clinical trials. The first one, already in the US, was conducted together with Cedars-Sinai Hospital and their outpatient cardiology clinic located in Beverly Hills in California. And so we had a variety of patients in different age groups from 20 something up to 90 years old, and the elderly patients we were able to enroll to the trial. And interestingly, that was one of the biggest aha moments. The elderly the patients were, the more they were interested to talk on a daily basis with our voice AI system and reported medical history on a daily or weekly basis. We had two major outcomes out of this study. The first one was that we reached a 97.5 percent of accuracy rate, meaning that we can take medical history as accurately as human beings do, and that CardioCube can then collect, index, and document this medical data all using a voice interface. And second one was kind of more from the section of user stories and what people wanted it to do in their daily lives. And so many people said it's great for cardiology, it's great for controlling my congestive heart failure, but I'd like also to use it for my full patient journey for refills or referrals. So we said how to go to the next step, how to make our software be like one part with the daily lives, so it works just as great as playing Spotify on your Alexa or ordering Uber. These are like the top two features used right now on smart speakers. We said let's make those consumer devices also have a healthcare meaning, a totally new meaning. And that's how we started our very successful partnership with Family Care Network. That is the biggest independent family medicine group in the US, providing care to over 100,000 patients in the state of Washington. And while doing this, we were totally aware of the fact that working on a bigger scale means also, a lot of things to consider. So, from number one, analyzing the current status of the product and asking FDA if we need any other approvals or registrations. Number two, understanding the how the situation is complex and that we have to integrate with the EMR and with a lot of other systems from other stakeholders like payers. And last thing, uh, we were dealing with a user profile, as said before, just as at the trial in Cedar Sinai for people from 18 years old up to 80 or 90. And also, we had to understand that at the very core of the primary care, we have to remember that it's relationship based, not just transaction based, and that's also a huge difference from going to a specialist when you just see a given doctor once. And in the case of primary care, we wanted the system to always be with the patient and try to be his friend on a daily basis. And from the business perspective, we tackled uh, three big problems. Number one, costs. Healthcare costs are bigger and bigger each year, especially in the US. Number two, access. A lot of people defer from contacting providers as they sometimes don't know what to do as the next step, or maybe it's actually also the cost of making this visit that's keeping them away of going to the clinic or making the call. And thirdly, inefficiencies. I know that inefficiencies are a very broad term, especially in terms of healthcare, but we wanted to target especially those that are administrative and that could be solved by taking the AI and help with the most basic things from patient reminders, patient check-in, and also the whole suite of integrations on the provider side, helping with the most mundane tasks. And so we first of all implemented what was really already tested to a very high extent. So our congestive heart failure treatment program. We then also implemented diabetic care. There's a really growing number of patients also in the younger demographic. And as the third part, we also implemented automated check-ins so that patient can check in and give the full medical history while still sitting at their home one day before the scheduled appointment. Uh, Doctors using this system started to love it. That's just one of the comments we had from Dr. Honey, who said this project has the potential to transform the way patients interact with their medical care providers. And I hope we're going to scale with that. And then we had March 2020. We all know what happened then and how the pandemic has escalated around the globe. And we then understood uh, our third lesson learned during our 4 year journey that in order to make a real change in healthcare, it's much easier to be and to do that being a services company than just one tech puzzle fitting to like to the big picture and to the jigsaw that you have. You can see on this slide the amount of searches on that's on Google, but same happened on all other search engines that people had with the keyword virtual urgent care or virtual care. We understood that we also need to help patients getting care whenever they want to. And so we during this path we had a lot of, and during the pandemic, a lot of requests from my fellow founders and other startup and other entrepreneurs or startup founders asking me where can I get help for my employees and my team, especially when they're being logged in their homes and I don't know how they're doing. So that's why we conducted a study with over 150 companies, especially from the small and medium sized market, so called SMBs. And it turned out that there are key four things, four problems they're struggling with. The first one being virtual urgent care for their employees. The second one being the continuity of care, so seeing the same provider on all appointments for this given patient and member. Also, one of the biggest things was that they had the concern how to help their employees with annual checkups and preventive care. So all those things taken together made us to make a very ambitious next step that was also developing like the full medical back office and backbone of the service. And that's how we became a healthcare services company. And we right now providing virtual healthcare to mainly employers in the US to help their employees. And so that happens through just paying a very low fee. There are no deductibles, no copays. And we thought how to make people want to make the contact from their side. So let's give them the possibility of having unlimited visits and also getting prescriptions being sent to the pharmacy of their choice. When it comes to smaller organizations, um, as we know that really well, as we're still regarded as typical SMB, life changes pretty quick for an entrepreneur. So we said, let's give them the flexibility they need so they can scale up or down the contract on a weekly or monthly basis, just like it's as easy as taking really a new desk at WeWork. And then we added the full suite of voice AI services we built for chronic disease patients before. And that's how you have three different use cases here on the slide, going from a typical virtual urgent care use case where somebody may have a headache and be nauseous, to somebody who's having higher blood glucose levels and may need some consultation. And to a third use case when somebody's planning some bigger goal, long distance goal, like for instance, running a marathon. And in all those use cases, those members have the possibility of doing this through a web based platform and having a call with a provider, human being. Also, doing this with like triage or continuous contact through a smart speaker with our voice AI system, and connecting all of the peripheral devices as well. So we have, and the doctors have, and the CardioCube health team has a full spectrum of knowledge of what's happening with this given patient and member. And that just all starts from $20 per member per month. I'd love to share with you as one of the last things uh, a great chart. It's representing the data of one of our patients. It's shown from March 2020 to July. So in the course of over 5 months, our system detected 9 alarms, helping to prevent unnecessary ER visits and hospital admits in the case of this very patient. And what you can see is this patient's weight. Yeah. Um, I'd like to end with a quote from Tom Castles, that you for sure know, who is the president from Rock Health, who said that Overcoming COVID-19 will reinforce that healthcare cannot go back to a time when virtual or automated care was not normal operating procedure. I think the same. I think that the world has changed, and that's why it's so important to give more affordable and accessible care to patients.